This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxia, and welcome to this special episode of Rural Health Leadership Radio. Today's guest is Ralph Llewellyn, partner in charge of critical access hospitals at Eide Bailly. Welcome to Rural Health Leadership Radio, Ralph.
Well, thank you. I'm glad to be in attendance.
Yes, glad to have you here. You are the partner in charge of critical access hospitals at Eide Bailly, and so you have a great level of expertise. In fact, yesterday you were working with on a module with our CEO certification cohort, so I know you're a true subject matter expert when it comes to this topic. But before we get into what you do in Eide Bailly and all that, tell us about yourself. Who is Ralph Llewellyn? What's your story?
What's my story? Well, I grew up in the middle of North Dakota, a small town, maybe not as small as some of our providers live in, but it was a small town in my realm. Grew up in a small family and had the opportunity to go to college, and from college moved on to actually a different industry before I got into healthcare. And after that, I really got into an opportunity to be a hospital CFO. Spent about 5 years being a hospital CFO, and then had this opportunity to kind of expand a little bit. And at that time, it was a chance to become more of an interim CFO working for an accounting firm. Started that 23 years ago, and after 23 years, I've done one interim CFO job, and everything else was everything but being an interim CFO. And
Okay.
Basically been working with rural providers for the last 23 years from the consulting side.
Excellent. And you've always lived in North Dakota then?
No, actually, when I first started out of college, I was living in the Minneapolis area, worked for a defense contractor.
Oh, wow. Okay.
Working in the area of cost control and a lot of financial reporting and things. The one thing I didn't like about that job was all of the financial oversight you had from all of these governmental auditor types.
Oh, man.
I got an opportunity to become a hospital CFO and didn't realize that I was just jumping from one fire pit to another one. So
Yeah, no kidding. Talk about oversight.
exactly.
So was when you moved to Minneapolis, was that moving south for you?
Yeah, most people wouldn't think of that as being south, but yeah, it was south. It was a much milder climate than what I was used to.
All right. Okay. Well, since you shared with us, you work for a defense contractor. What the heck got you into healthcare? Why did you make that switch?
Well, I always knew I wanted to get back closer to my roots. Minneapolis, I loved my time there. It was a great experience, but I was definitely a more rural type of person. Even big city North Dakota is still kind of rural. And was looking for an opportunity, and one of my colleagues had a headhunter call and wanted to know if they wanted to be a CFO of a rural hospital in the middle of North Dakota, and timing and everything wasn't right for that person. So I got a call, and happened to be 75 miles from where I grew up, and we had family in that area, and I took a jump.
Seemed like the good fit, huh?
Yes, it did.
Well, that's pretty cool. Your first job in healthcare was as a C-level executive. So what an entrance.
It was another baptism by fire.
Yes.
But I had a great support team around me and good leadership at the system level. It was a very small system, just a handful of providers, but enough support and enough tools to let me take and run and do things and experience a lot of things that a lot of others didn't get a chance to do.
Well, it sounds like that job got you closer to home, closer to family, which is always nice. But I mean, you could have stayed in Minneapolis or gone to any other large metropolitan area for that matter. Why did you decide to focus on rural?
Again, just from what I grew up with, I like some of the big city aspects, but I like the small town probably more so.
Okay.
I live in Fargo, North Dakota right now. Some people would call that big. Some people would call that small. It's all
Right.
perspective.
Absolutely.
What I like about it now is I'm 3 hours from being in downtown Minneapolis, if that's where I want to be and experience all of the experiences and advantages of a big city.
Right.
But if I want to take 10 minutes and drive out of town, I can be basically in the middle of nowhere, which is really where I really like to be.
Gotcha. Understood. Understood. So, Ralph, as you know, the name of this program is Rural Health Leadership Radio. I emphasize leadership. What's your definition of leadership?
You know, I've thought about that a lot over the years, and I really think that in the rural setting, it's really leadership by example. I always told my team when I was a hospital CFO that, you know, the good part was is that they had me as their advocate. The hard part was is that I led by example, and being the financial leader meant that, you know, we managed our finances and things
Right.
like that. But I always thought that that was really the piece there. You know, having to stay ahead of the game, staying on the leading edge of things, making sure you're taking educated risks,
Yes.
because you can't avoid all risk.
Right.
You know, you can't do anything if you don't take some risk and understanding. Um, Very much about educated risks, sharing the knowledge, building the team around you. I was very fortunate when I was in my role. I had a great team around me that supported me, and frankly did a lot of the things that made our department look good.
Excellent. That pays off, doesn't it? To have the
Yes, it
surround
does.
yourself with the right team. Well, thank you for sharing that definition with us. Can you give us an overview of Eide Bailly and the community that your company serves?
Well, we are a top 25 CPA consulting firm in the United States. Uh,
Okay.
and with that, we operate in multiple states. When I started, it was 8. Now I think it's 23 or something. It's growing all the time.
Okay.
Um, but it started in a rural setting. It's the predecessor firms of Eide Bailly were Midwest, small community type areas. And you know, with that, we've grown. We serve multiple industries. Fortunately, from my perspective, healthcare has been the largest industry,
Hmm.
and within that, rural is a big bucket. And when I think about why, you know, why are we focused that way? Well, the firm started out rural. When we started doing healthcare in the 60s, a lot of that was back when Medicare cost reports and things like that were starting. Um, it was in a rural market. I
Okay.
look at the leaders and people around me that I work with on a day-to-day basis. Most of us grew up in rural,
Okay.
and so we've all got this focus around rural that we do. Um, and so with that, as far as, you know, the footprint or the community that we work in, I would say our community is rural health.
Yes.
You know, from the group that I work with and the consultants and the auditors. But if you look at the overall footprint of the country, it can be anywhere around the United States. It is probably a little bit more predominant from um, the western, maybe 2/3 of the country. You know, we
Hmm.
don't hit the eastern 1/3 as much,
Yes.
mostly just because of office locations. But as we've seen in the last couple of months, more and more things can be done remotely and through virtual means. So uh, the distance doesn't necessarily preclude us from being all over the place. So
Yeah. So, a big firm like yours, even, you're part of the firm focused on rural health. The firm focuses on other industries like you were talking about, but I'm guessing that the COVID pandemic had an impact on your organization. What impact did it have?
well, it's interesting. We just had a call earlier today, a full staff call. Again, so these things you do when you're in a virtual world
Right.
with their managing partner. And our firm has about 3,000 employees.
Okay.
And about the middle of March is when we basically went remote. And so I was actually on the road that week working with some providers when we got the call to get home and you know, work remote. Offices were basically for the most part shut down. Skeletal staff to take care of some immediate needs that we had to have done, but were set up in such a way that you could do your social distancing. Um, the office that I'm working in now is actually right here is my home office. I
Okay.
have been in my home office since March 20th. And that's kind of the way the practice has moved. So a lot of my team and my staff I have not seen except for calls like this where we're having, something televideo.
Right.
Zoom has become everyone's best friend, or whatever
Yes.
conduit you have.
Yeah.
And so it's changed a lot from that perspective. But just like hospitals having to look to reopen, that's kind of where we're at. And now we're looking at, how do we reopen and how do you bring services back online in-house? Ours is obviously a much easier process
Yeah.
than somebody who's dealing with healthcare lives and things like that. As an industry, working in healthcare, we still struggle with it from both sides because we're dealing with the things we got to do with our team.
Right.
Now the requests that we're starting to see from our providers saying, hey, we want you to come out and do some work with us. Well, now we actually have questionnaires as well as they have questionnaires about what are all the safety precautions.
Right.
I would say our providers are the clients that we work with are a lot more prepared because obviously they're doing it for their patients or their residents.
Sure.
Some of our other industries, when you send them one of those things, they're like, well, what do you mean we're a manufacturing plant?
Right.
So, but it has been interesting. We just started reopening our first offices last Monday.
Okay.
And so it's a 50% capacity and all kinds of testing at the door and tracing and everything else, trying to be good stewards of our team and our
Sure.
resources and,
Sure.
keep them safe.
Right. And I'm guessing that for you, some of your clients that are critical access hospitals and in rural healthcare, are they turning to you to get your advice on how to help them return to normal?
We're fortunate on our team. We do have some clinical staff. So I have a couple of RNs on the team and operational folks. So we're having conversations about, how do you properly, plan to reopen your OR?
Mm-hmm.
And what does that mean everywhere from the front desk of registration and everything else to the safety and, what happens to the amount of time you need now, because in the OR there's, new cleaning and, turnover guidance and things like that. So we're getting asked a lot of things in that arena. I would say the other piece that we're getting with all of the things that are going on right now would be around all of the COVID related funding.
Right.
Our rural providers, back in the middle of March when all of this started, they were all trying to figure out how they were going to keep their doors open because they could see how fast the cash was going to bleed.
Right.
And based on history, we were very concerned of would cash get to them quick enough to keep them, from having to close their doors and put more people at risk. To now, all of a sudden, all the funding has come out, and some providers have a lot of money right now in front of them. And now they're trying to make sure that they're being proper stewards of that money,
Right.
trying to make sure that they're meeting all the rules and requirements that go with it as far as reporting, documentation, and everything else, so that they don't have a risk of having to return some of that money.
Sure. Yeah, that makes sense.
So our phones are ringing all the time.
Yeah, that's a good thing, right?
Yes.
So you've kind of already answered this, but one of the questions I want to ask you is why rural health is so important for your organization.
Again, I think it just becomes, that's where so many of our people came from.
Yeah.
And with that comes a passion. And, we've got a lot of people that have also worked in rural healthcare settings.
Okay.
A lot of our revenue cycle folks, myself, some of our reimbursement folks came from that, the clinical folks, they've worked in that setting.
Right.
And I think once they get the chance to work in that setting and find out that what I like most about a rural setting versus some of the larger settings that I work in is the ability to make things happen and make them happen quickly
Mm-hmm.
when they need to. I know we struggle in the rural setting sometimes with having the right number of resources and number of people to have the bandwidth to get things done. But on the flip side, when you get to the large organizations, you have a lot more levels and barriers you have to go through. So what might take a year or two to move in a large organization, in this small rural setting, you can help move that that marker a lot faster,
Got it.
more effectively. You can see the results occurring. They seem much more appreciative when you're out there. And so you can see that success. And, and we're like anybody else. We like to see something that we've done have an impact.
Sure.
And you can sometimes see that impact happen a lot faster because you can make things move faster.
Yes. Yes. I get it. Okay. Thank you. So when leadership is looking to hire a firm like yours,
Mhm.
whether it's you or anybody else, they're looking for an outside source to provide services that you provide. What are the top 3 things that a healthcare leader needs to look at or to consider in that decision-making process?
Well, there's a few I think that really stick out. I think first and foremost, you got to look at the depth of the technical knowledge.
Okay.
It's not equal across the board. There are a lot of great firms out there, a lot of great people that do a lot of things that we do, and there's a lot that I would say are not as is in depth. But you really want to make sure that the people you're working with have a great depth. I think the other part, again, why we do rural, is I think you want a team that understands the organization. They've worked in an organization. And I always think that having worked in the organization, it's easier for me to relate to something I say and what it's going to mean to that entity.
Yes.
And I think when you work with somebody that's been in the organization, you have people that understand, they've learned something and they want to do it with you. Versus if you have people that have just read something in a book, it feels like they have something they want to do to you.
Okay.
So I think that piece, and then you really want to have somebody who shares your passion. I tell our team that the best thing in the world that can happen is that we are as concerned and worried about their business as they are.
Sure.
Because if they fail, we should feel just as bad as they do.
Yes.
We should feel the same way. And so those are the things. I think you need the knowledge. You want people that have the experience in the setting, and you got to have people that have the passion.
Great.
They're there for the right reason.
And that passion makes a big difference, doesn't it?
Absolutely.
Yeah. Okay. Thank you. So, on Rural Health Leadership Radio, we're all about sharing best practices with each other. So what are some of the best practices that you've seen some of the top rural health leaders embrace that you've worked with around improving their financial performance?
There's probably, I'd say, 3 areas that I've seen facilities really being able to make a difference if they're willing to commit.
Okay.
And that commitment's a hard piece because they have so many pieces pulling from so many different directions.
Sure.
First and foremost is improvements in the revenue cycle. And I know everybody gets tired of hearing the revenue cycle. You got to fix the revenue cycle, you got to work on the revenue cycle. And a lot of times when I have conversations with folks, they'll say, yeah, we know we got to do that. It's like, well, but have you done anything with it? Knowing that it has to be done versus having done something are 2 different things.
Right.
And in almost every facility we've worked in, there are still huge opportunities to pull more cash out of the work that they've already done. And it's a lot easier to get that cash than it is to go find other patients and other services and everything else, that if you did even get those other services and other patients, you still wouldn't be collecting everything from them either.
Right.
So, there's that piece. We've also seen a big improvement, I think, in the last couple of years in the area of just operational and productivity performance.
Okay.
For a lot of years, and I was as guilty of it having been a hospital CFO at one point, of everyone saying, well, we're minimal staffed, we're core staffed, we can't be any tighter. And a lot of times there's some truth to that based on the processes that we have set in place. Meaning that we may have people that are working really, really hard on broken processes, but if we would fix the process, what it takes to get from point A to point B, maybe we could do things with a lot less. It kind of like, if I was talking to a group in Fargo, North Dakota, where I live, and I'd say, how long does it take to drive from Fargo to Minneapolis? And they're all going to tell me 3.5 hours.
Okay.
But then I'd change that and say, well, what I didn't tell you is you have to drive through Sioux Falls, South Dakota. And what I'm getting at by that is how often in our organizations Do we have people that are trying to get from Fargo to Minneapolis, but their processes in the organization have told them that they have to drive to Sioux Falls first? And it doesn't matter how fast you drive to
Right.
Sioux Falls and then to Minneapolis, you can never be efficient. And so people are looking at their processes of saying, how do I take the straight route? And through that, we're improving the efficiencies, and then next comes the financial performance of the organization. The other piece, the third one, is data. Several years ago, when we were talking about data in small organizations, I was a firm believer that we would probably not see it for decades just because of the cost of getting to the data.
Yes.
Now we're starting to see organizations using different business intelligence tools such as Tableau, Microsoft BI, everything, pulling all of this data together, and we're getting near time reporting. So we know what happened yesterday. We know what happened yesterday, so we can make a change today, and we'll be able to find out tomorrow what the change did, and we can make more changes. And that can affect productivity, it can affect quality, it can affect financial performance like days in AR, all of those things. And that is another huge piece.
Yeah, absolutely. I going back to your second point of driving from Fargo to Minneapolis, that's a great image and story to help explain your point there. I love that. I may steal that from you if you don't mind, Ralph.
No problem. I'm sure I'm not the originator.
Thank you. So I know you've worked with a lot of rural hospitals with regard to like all those things you were talking about, the best practices you were talking about, revenue cycle and streamlining processes and managing data and all that. Can you tell us about one of your clients that they've seen top level performance by embracing some of the things that you are talking about, how your services have really benefited them? Any examples or stories you can share around that?
Yeah, I was thinking about, what to talk about here. And I think the best one is it really is evolving around data, because data helps us with all the other pieces.
Yeah.
And so we had a provider we had an opportunity to work with to help them. They wanted to better see their data. They wanted to better understand their data, because then their managers would be able to see better data. They'd be able to set better goals. They'd be able to, better accountability and everything else. And so it started out with mostly just financial data. And so it was pulling financial data using a BI type tool
Okay.
to gather that. And from there, it whet the hunger. Now I want a little more. And it's grown to now where it is looking at staffing. And so as quickly as you can get your staffing and your statistics into your various systems,
Yes.
the quicker you can report back. So you can have the director of nursing looking and saying, yesterday I had X number of patients on the floor and I had X number of hours of staff. Why did I have that many hours of staff? That's not my staffing pattern. What are we missing? Let's go back, let's tweak, let's remanage. You can do that in every department. I don't want to just single out nursing. They're usually the common one that people talk about.
Right.
But it can be housekeeping, it can be laundry, it can be lab department, all of those components. And you start getting these reports on a daily basis. And the interesting thing is that just by getting those reports over a several month time period, they started to see their cost of labor going down, because they started questioning themselves just by having the information and data. It wasn't necessarily that a benchmark had to be set.
Yes.
But they could start to look at trends, and why did I do better on Tuesday than I'm doing on Thursdays? What's going on Tuesdays versus Thursdays, and and things like that. And you start digging into there, and now they're moving into even being able to track quality reporting.
Mm-hmm.
So the next piece that we're going to be looking at with that entity is we're hoping to be able to build upon more of a population health module.
Gotcha.
So you can start looking at that. The hard part there is you got to get a lot of claims data that they don't always have access to yet.
Right.
But it's taking that, and that's a small rural provider.
Mm-hmm.
That's a critical access hospital. That's not a 500 bed, PPS hospital that has a totally different amount of resources. And we're starting to see more and more facilities now around this one doing the same thing, saying, wait a minute, we want to get that kind of data. And now they're getting to a conversation of what can we do to share data
Ah,
So we can
okay.
start to learn best practices off of each other,
Hmm.
because then you lose that, well, other hospitals can't do this either or whatever. Well, no, we have a neighbor that does. Let's talk to them.
Right.
What are they doing?
Yeah.
So data is it right now.
Yeah. And know what to do with it, right?
Yep.
Yeah, very good. Thank you for sharing that. That's very intriguing because I know I've heard people talk, well, we got all kinds of data. What do I do with it?
Yep.
And you bring meaning to that
Yeah.
real
You
meaning.
got to convert it to knowledge.
Yes, wonderful. Well, you've got an interesting career path, Ralph, having been a CFO and now all your years as a CPA with Eide Bailly. What scares you the most? I want to hear your perspective on this. What scares you the most about healthcare in rural America?
The financial challenges.
Imagine that.
Um,
Can't believe you
yeah.
said that.
When you think about what's happened since 2010 and
Yes.
in all of the closures, and we see that, um, I'm hoping that the country learns something with all of the COVID things about some of the challenges and dangers of um, aggregating all services in small pods and in specific spots in a state, with all the accumulation and aggregation of things, and understands the value of rural from that perspective. But with those financial challenges, I also worry about the ability to attract the talent. Where are we going to find the new and upcoming talent?
Right.
I oftentimes ask CEOs and CFOs if they are, recommending their career to their children.
Right.
And it's not yes as many times as we would
Yeah.
hope.
Yeah.
I would love it if my kids would want to do this, although they don't understand the accounting thing and don't want to do that. And fortunately, 3 of them have gotten into healthcare.
Yeah.
Um, but it's that leadership piece, because the challenges require educated and bold leaders, and I'm concerned about that next generation. Will we be able to attract them?
Yes. Valid concerns. So let me flip that question around. What excites you the most about the future of rural health?
The advent of technology.
Mm-hmm.
And I take that from 2 sides. You've heard me already talk about the business intelligence side of it.
Right. Right.
I think that gives us some opportunity. But I think everything that we've seen in the area of telehealth and e-visits and things like that, I think for a long time we have been somewhat appropriately scared that might be part of what could be the demise of even more rural healthcare,
Yes.
because we look at that as the ability for the big cities and the big areas to steal more of our volume
Mm-hmm.
and attract things without people having to leave their homes. I think that the opportunity there is, one, how do we take advantage of the telehealth to take care of the people in our areas? But then how do we also take advantage of that telehealth to help utilize maybe some of the gaps in our capacity when we have more, maybe a type of provider who has not enough visits or enough work for our community, but we need to have them. What can we do to be selling those services into the bigger communities? So it's kind of flipping that negative into a positive.
Yes.
And I think that we're starting to see some rural providers saying, how do we take advantage of this
Right.
instead of trying to poo-poo it and push it in a corner and try to ignore that it's there? It's how do we be the first one out in front of everybody
Mm-hmm.
and take advantage of it to be a positive for us, a net positive
Right.
versus a net negative.
Yes. That is exciting. Thank you for that
Mhm.
perspective. The time has flown by, Ralph. We've talked about a lot of different topics here in the short time we've been talking to each other. If our listeners only take one thing away from our conversation today, what should that be?
The importance of adopting the new technology. I
Okay.
think we've got to open up our minds and look at it, understanding that the cost is not what it used to be,
Right.
and understanding that as time goes on, it will get cheaper, but that doesn't mean that we can just keep waiting for it to get less expensive.
Right.
We need to start dabbling. There are ways to dabble and get into some tools and things that are quite amazing. And the pandemic, I think, has proven that more of our population is open to it.
Mm-hmm.
We are seeing our seniors take advantage of telehealth and liking it.
Right.
My mother, I would have never thought would have. She just sent me a message today saying, "Are you okay? I'm going to actually go in and see a physician for the first time in 4 months." But she really likes her televisits now. She doesn't have to, get all done up and get ready to go out and do her thing. She can just do it in her home, and if it's cold and rainy, she doesn't have to worry about it.
Yeah, that's cool. That's very cool. Thank you for sharing that. Ralph Llewellyn, partner in charge of critical access hospitals at Eide Bailly. Thank you so much for sharing your knowledge and expertise with us today.
All right. Have a great day.
Thank you. If anybody would like to connect with Ralph, his email address is in the notes below this video. You can find his contact information there. You can also learn more about Eide Bailly by visiting their website at eidebailly.com. That's EIDEBAILLY.com. And if nothing else, you can reach out to me and I'll be glad to connect you with Ralph. If you'd like to learn more about Rural Health Leadership Radio, you can visit our website at rllradio.com, or just use your smartphone with your podcast app and search for Rural Health Leadership Radio and subscribe today. If you enjoyed this special episode of Rural Health Leadership Radio or know someone who might benefit from it, please share it. We're here to serve you. Until next time, let's keep working to improve rural health, one conversation at a time.